We're going to start with the pig on his dorsal side, so ventral side is up. You can see we've got his arms kind of tied down with rubber bands so that we've got some nice good space here in the middle to work with. So we're going to start on the medial or mid-sagittal plane here in the midline of the body, and we're just going to use the scalpel to start opening up under the chin down to the thoracic cavity, and then from the thoracic cavity down to the abdominal cavity. So to do this, we're just going to take our scalpel and we're going to make a cut right here down the middle. And as we cut, we're going to start to peel back because we don't want to go too deep. So if you start to peel, and you can see there's muscle in there. So we need to get through that muscle. So we need to cut just a smidge deeper. And then start to peel a little more. And then when you have enough where you can just kind of get your thumbs in there, you want to peel that skin back. The least amount of time we spend using the scalpel, the better off we'll be. Most dissection really isn't about the cutting process. It's kind of about the isolating process and cleaning a little bit. So now we're starting to open things up, and you can see some structures down in here. The first thing that's going to come into view is going to be that larynx. This is his larynx right here, which we commonly might call our voice box. That's the larynx. And you can see these kind of bulges on the side right here. That's the cervical portion of the thymus, and that's symmetrical. There's two of them. So there's one on his right side, and there's one over here on his left side. And I'm just going to use my fingers, my hands, and just kind of push away some of that connective tissue and muscle that's attached to these structures. And as we use our fingers, you'll see he's opening up much better. We can start to see these structures. So now that I'm getting right about here, there's a bone there. That's his sternum. So we're going to have to cut through that breastbone. We're still going to keep our scalpel. We're just going to have to bear down a little bit more, maybe even saw a little bit back and forth to kind of cut through that bone. Now these are fetal pigs, so the bone is still going to be relatively soft. And we just do a little bit of cutting and peeling. I still got some bone right there I need to cut through. Just a bit of pressure, and that'll cut through that bone fairly well. Be careful, make sure that you don't get your fingers in the way. Scalpel's going to be sharp. Now you'll start to see some vessels begin to appear. If I can get my hand under that, I don't know if you can see that. There's a blue vessel right here. That's going to be a mammary vein. That's one of the veins that drains deoxygenated blood from the rib cage, from that thoracic cavity. We're going to cut through that because we can't really pry him open when he's connected to the blood vessels there. So I'm just going to cut away from the pig because I don't want to go deep and end up cutting his heart or maybe some lungs over here to the side. So I'm going to take my scalpel and I'm just going to cut upward away from the pig, and we're going to cut through. See how it's real stringy? That's because there's dye, there's latex in these vessels. So it's kind of that latex that you're seeing there. So we cut through that vessel, and there'll be another one. That one was coming over here to his right thoracic cage. There'll be another one over here coming to the left. So as we open him up some more, we'll find another one of these vessels that's there. So we're going to continue to cut down, trying to get to the bottom. And as we're opening, I want to draw your attention to some of these membranes that is starting to appear. I'm going to switch to my probe. This is the probe we can kind of use to point. If I lift up right here, you can see this very thin, clear membrane. This membrane is the pleural membrane. This is what's covering the lungs. Now we're going to cut through that. We have to break through that in order to be able to see the organs in that thoracic cavity. So I wanted to point it out because we're about to bust through it a little bit, and it's very delicate. I can use this probe and just kind of peel it right open right here. And now it exposes the heart, okay? And there's lots of juice in there. That's because there's pleural fluid. There's fluid that surrounds all of the organs to make sure that friction is reduced, to keep low friction here. So organs can move and back and forth, you know, very easily with little restriction. So there's going to be a lot of fluid in here. We might even have to take our pig to the sink, kind of drain it and dump it out a little bit, and then come back and continue the dissection process. At this point, we're going to get into the abdominal cavity. But the diaphragm of the pig is attached to the body wall. So if we were to just start cutting down the body wall, we would split the diaphragm in half. So before we continue to open, we have to separate the diaphragm from the body wall. So we're going to take our hands and just kind of push that diaphragm away from the body wall. Now I know it's kind of difficult to see, but when you get your hand in there, you can feel it. The diaphragm is there and it's attached to that body wall. If I was to try to open it so you could see it, I would end up cutting the diaphragm, which is what I don't want. So we're just going to push that diaphragm away from the body wall. And once we have that, and you can kind of move your hand kind of freely back and forth under there, we're going to switch to our scissors. Okay, so now with scissors, and we're going to cut down to the umbilical cord, like so. Now that I open it up, you can actually see that diaphragm. There it is. Right there's the diaphragm that was going to be sitting right on top of that liver, and it's right below the heart. This structure right here is the heart. Now you can still see some of these membranes that's here. The pleura, which is over here to the right, is going to be surrounding the lungs, and you're seeing a hint of the bottom of the pericardium right here. So the pericardium is the sac that surrounds the heart. The pleura is the membrane that surrounds the lungs. They're all kind of attached to each other. And when we went down and we cut through that thoracic cage, we split those membranes open. So the pleura has been split open over here on his right side. Over here on the left, it's still attached. So you notice you can't see the lungs just yet. There's still a membrane there. I can get my hand under it right there. But we are going to cut through it. I'm going to break through it. There we go. And then now we're able to see his left lung down here in the back. Okay? All right, so that's the membranes. Come down, that's the diaphragm, and the bottom of the pericardium is still attached to the diaphragm. So you see that membrane right there? We're just going to break through that membrane as well. Okay, and now we're ready to continue and open up the abdominal cavity. So I used my scissors. I got down here to the umbilical cord. Now I'm going to cut around the umbilical cord and stay on the lateral side all the way down through the inguinal region. Same thing over here, around the umbilical cord, continue down into the inguinal region, okay? So we're just gonna cut around, make sure that diaphragm, they're still good. We're gonna start to run into the next membrane called the peritoneum when we get in there. And I think I just broke through the peritoneum, which is what we're gonna have to do, but there's a lot of juice, more water right in there. You can kind of see it kind of in there. That's all the fluids that's in the abdominal cavity that was in that peritoneum. And when I just broke through the peritoneum, you kind of saw that fluid emerge. I'm going to start to cut around the umbilical cord. And I'm going to continue on this side, kind of using the umbilical cord kind of like a handle. Okay, and then we're just going to cut down this inguinal region like so. Same way right here. Down here like so. Now you're going to notice I can't really remove this part or move it back yet because there is a vein right here. That's called the umbilical vein. It attaches the umbilical cord to the liver. This organ right in here is the liver. So we're just going to snip that. And once we have that snipped, now this portion will lay back, okay? Now, here's a really good view of that peritoneum, okay? The peritoneum is the membrane. It's a serous membrane is what category it fits in, and it surrounds the abdominal organs. So you'll see it's attached to the body wall, right here, over here on that side. So what we're going to do is we're just going to separate it from the body wall, because this is one of the structures you need to know. So I'm just going to peel it away from the wall. Same thing right here. Peel it away from the wall. Okay. And then I'm going to take my scissors and I'm just going to kind of trim the sides of it off of the diaphragm so that I can see these organs better, because it's hiding, it's covering a lot of these abdominal organs and we can't see very well. So I'm just going to make a cut, and we're just going to cut right along the bottom of the diaphragm so that this just lays back. Okay, same thing over here. At this point, we have our pig open, so we can see up here in the cervical region, the thoracic cage is open, and we can see the thoracic organs here in the thoracic cavity, and then we're down here open as well in the abdominal cavity. So now that we have the pig open, we're going to start teasing away some of the muscle and connective tissue to expose the specific organs. Now, the first thing up here in the neck, there is a muscle that runs right down the midline right here that we're going to remove so that we're able to see the larynx much more clearly. We can see the thyroid gland under that, and that will also help us isolate the cervical thymus that's here as well. So all I'm going to do is use the probe, and I'm going to get underneath this muscle right here, just kind of rake back and forth, and you'll be able to kind of break through some of the connective tissue that's holding the muscle in place. And then we can just use our fingers just to peel away this muscle and this connective tissue. Now we're going to peel slowly, because underneath this muscle we're going to start to see the thyroid gland, and we don't want to remove the thyroid with the muscle. That sternal region, and it'll peel right off since we've already removed and cut through the sternum that's there. So we're just going to remove that muscle. Now when we did that, look at these organs that have already started to appear. So we've got a good view of the larynx right here. On the sides, almost like butterfly wings, we've got the cervical thymus. Now we call it the cervical thymus because it's up here in the neck. I'm just going to use the probe to kind of peel away some of that connective tissue. That way we can kind of isolate and see the gland much more clearly. Okay, now if we open up these butterfly wings right here of the thymus, pretty much where we would just remove that muscle, you'll see the thyroid gland. This little reddish round circle, sometimes it appears gray. That's the thyroid gland right here. And if we roll the thyroid gland over a little bit and clean away some of the connective tissue under it, we'll see the trachea. See that trachea, those rings, that trachea coming right below that larynx. Okay, now as we work our way down, we're going to get here on top of the heart, and you can see it's still kind of cluttered. There's stuff here, so we're not able to see the vessels very clearly. To clean this up, we're going to remove the thoracic thymus. So sitting right here on top of the heart is another area of the thymus gland. So we call this cervical because we're up here in the neck. We're going to call this part right here thoracic thymus since we're down here in the thoracic cage. And we're just going to remove this. We're going to cut it off because it's difficult to see the structures of the heart if you still have that thoracic thymus. So I'm just pulling that off. And there's going to be some little pieces here that are going to be attached. I'm just going to use my scissors and just kind of cut away. And I'm going to use the blunt end of my scissors as well to just kind of help separate and pull out some more of it that may be a little bit deeper down in there attached to the pericardium. You can see it just kind of sweeps right out. And if you still have some portions of the pericardium around your heart, just kind of peel it back to the side like so. And then we'll be able to see the chambers of the heart much more clearly. Okay, so now just by removing that thoracic thymus, you can already see this nice big blue vessel coming off the top of the heart. That's the superior vena cava. For now, with our very first lab, we're just really focusing on the major organs. So we're pretty good up here in the neck. And then we've got our thoracic cavity nice and open, and then we've got our abdominal nice and open. So we're ready to start naming and identifying some of these organs.